My upper extremity rehab secret is painting. Painting can be used for patients who need extra motivation to continue the rehab at home. It is a good rehab secret because it is fun and people may not even know that it's doing exercise at home. It can be used, the way I'm going to use it is for the shoulder muscles, especially the deltoids, but it also could be used for the elbow and wrist if the clinician wants to focus on the entire upper extremity. In order to do this, the patient needs to be either sitting or standing with an upright canvas. It is key for the patient to keep the elbow and wrist fixed in order to work the shoulder muscles and do all the motions with the shoulder. Also, since the shoulder will be in abduction and flexion the entire time, the muscle will be contracted isometrically. First off, you can have the patient warm up their shoulder by doing small circles for about a minute, and then you can have them do big circles. And you can alternate between these, or you can just keep a set time for both of them. Like they have to do small circles for 5 minutes and big circles for 10 minutes. First, we'll start with short vertical strokes, which will work the anterior deltoid isometrically. And you can have them do this for a set amount of time, like 2 or 3 minutes. Or you can have them do it for a number of strokes, like have them get to 50 strokes. Or if you wanted to do it with speed, you could have it do a certain amount of strokes within a certain amount of time. And then we can progress this to long vertical strokes, which will work the anterior deltoid concentrically. And you can do it for the same set amount of time, or strokes within a time, or just a set amount of strokes. And then you can progress this further by having them do vertical strokes that go up quickly and slowly go down, which will work the anterior deltoid eccentrically. The second exercise you can do is you can do horizontal strokes, and you can start off with doing short horizontal strokes to work the middle deltoid isometrically, and then you can do it for the same amount of sets or timing, and then you go into long horizontal strokes, which will work it concentrically. And then again, you can go into long horizontal strokes that go quickly out and then slowly back in, which will work the middle deltoid eccentrically. So the last exercise we can do are diagonal strokes, which are more of a functional movement, and it's moving kind of within that PNF pattern. So you'll start with short diagonal strokes, and you can progress this to long diagonal strokes. All of these exercises can be further progressed by adding an ankle weight, or if you attach a TheraBand and have the therapist hold it, or someone hold it if they're at home also. You can also work the external rotators by keeping their elbow at their side and doing horizontal strokes. You can also work their wrist by going up and down, which will work ulnar and radial deviation, and then you could go side to side, which will work wrist flexion and extension. And then lastly, you can work the elbow by going up and down and keeping your wrist and your shoulder fixed, and have the motion go through the elbow.
Encourage your patients to get silly and use a different variety of brushes and colors.
When you're done, you can have a cool painting like this. Ta-da!